Welcome back to our Bluesy Water channel. I wanted to do a follow-up video on our treatment protocol for the middle ear and the station tube. I was recently demonstrated this technique in a Promolife uh, promo cast, and I just want to do some follow-up because I have had some feedback. So first of all, I'm going to show two techniques. The first technique mimics a device called the Eustachian. It's a very simple technique, but instead of pushing regular air with the device, you're going to be using the syringe filled with ozone. The second technique is a technique I learned from my ear doctor. I don't see this something you can find readily on the internet, but it's a very simple repositioning or maneuvering of this bone to essentially create a pathway directly into the eustachian tube. So I'll demonstrate both these techniques. Warning number one, you never power plunge the syringe. If you're doing a sinus and you go up the sinus cavity, sinus insufflation, and you go rather rapid, there's enough space in there that you're not going to feel too much back pressure. But if you had a lot of congestion, yes, you would want to go slower. It's never a great idea to go super aggressively on the sinus cavity. When I do rectal insufflation ozone, there's a big open space. Sometimes I'll really push that syringe to drive the ozone deeper. If you're doing around 60 cc, you're going to fill up the space in the sinuses pretty well. But once you're diverting up to the eustachian tube, it's a very small volume. So you don't want to pressurize. Warning, very important warning. Okay, the Eustachian technique, I'm going to just show a quick video so you understand how that works.
That's where my secret weapon comes into play, which is the Eustachian. Now, this is not a sponsored video for Eustachian. They have no idea that I'm doing this video, but this little tool right here can fix almost every single case of negative middle ear pressure out there, and I have failed at this point to find one particular case where it does not work. That being said, the Eustachian is a tool that has been designed to eliminate negative middle ear pressure by pushing air through your eustachian tube into your middle ear space. It does this by creating a gentle stream of air that comes out of the tip of the eustachian there, and when you push this little button right here, it has a flow of about 5 psi. Step 1 is to put the tip of the eustachian with the hole up to your nostril on the affected ear side. Step 2 is to push the button to start the flow of air. Step 3 is to plug your other nostril with your finger, and step 4 is to swallow, which gently forces the stream of air from the eustachian through your eustachian tube and into your middle ear space to eliminate the negative pressure. It really is that easy, and it even works on the most stubbornly clogged ears when swallowing, yawning, and plugging your nose and blowing don't work.
It's that simple. The only difference in this technique is we're going to be using the syringe instead of the eustachian. So we need to, now the problem is if you're going to, let's say, do it, if you can get your hand and do the seal with your finger, great. You're going to, now one thing is important, make sure the butt of the syringe is really pushed in solid. It's the contour of the butt of the syringe is about similar to the eustachian, and it will make a seal. There's a pretty good seal there. Breathe in. Okay, so get a really good seal. Push this thing. You're gonna have to do pretty firm to get, because I'm breathing out here. I can feel it pressurizing. So you're gonna have to get aggressive with butting this up. Breathe in. Always breathe in when you're doing ozone, so it protects your lungs. So I'm gonna breathe in, hold my breath, gently push the syringe, and then I'm going to swallow. Now, I swallowed several times. You could do it once, take a pause, do it again. Once again, you got to get the seal. Now, you could always use this. I'll show a link for this. This is a silicone earplug. I have two together, Max silicone earplugs. Really, if you want to have more control and not worry about and you're having a hard time handling the syringe, you're going to have to really work it in there. That's why I use two together. That's sealed. Now you could even really focus on holding this and firming it up, both hands, and you can really, it's a big syringe. Some people are gonna have a hard time getting doing this one-handed. So now, if you can't swallow naturally, you can even put some water in your mouth or have a straw and sip water and do the swallow. So again, I'm going to go over this. It's breathe in to block ozone from going to the lungs. Butt this up really good to get the seal. This is already sealed. So the swallow is diverting the ozone up the eustachian tube. Okay. So this is technique number one, mimicking the Eustachian. You got to get the good seal. I found that blue. I tried those blue tips that we demonstrated with Tobias, and I didn't get a seal out of that. I wanted the extension on the syringe. You can try it. Uh, I think the butt of the syringe push up is the best bet. Again, I think it's good to have control and really focus and make sure you're pushing up. And it's going to be hard to reach the plunger for some people. So I like the idea of plugging it up. But if you're good, if you're really dexterous and you can do this, fine. Now, why this versus the Eustachian? Because if ozone goes up the Eustachian tube, in my case, I had a middle ear infection. I had a post-COVID issue. Now I want the ozone to do that antiviral work. I also had fluid in my middle ear, so it worked on a lot of levels. But if you have any kind of inflammation, infection, you want to use ozone as ozone is used for any sinus infection. It's a sidebar to the sinus cavity where microbes can sneak away. So you could have a lot of issues, but if you know the healing benefits of ozone, getting it up there as opposed to just regular air it can be amazing, especially if it's an infectious situation. But it can also tonify the tissue in the eustachian tube, and also you could just equalize the pressure if you have blocked, clogged ears. So remember that swallow is what initiates I call it a vacuum suck of a sort, but it allows the ozone to go up the eustachian tube. You got to have that swallow in the mix. It's got to be sealed environment and the swallow, and of course, protect the lungs. Technique number two. This is where you can actually do these two together, but again, you have to be very gentle with the syringe. So if you're, let's do the opposite now. I've actually had a lot of systemic problems with my right eustachian tube over the years, the middle ear due to playing saxophone. I never knew any of this back then, but it was always like an ongoing inflammatory situation. So here's where ozone can work wonders and just completely heal. If you're a horn player and you notice some eustachian tube issues, I know players that had to quit because of this. You can do this and help as a follow-up to aggravations that might be being created. Okay, first I'm going to just show this technique standalone. This is good by itself. You don't need to create a seal. You're just going to roll your bone. This opens up the tube and directs it straight to the middle ear. My ear doctor showed me this, said do 2 sprays of Flonase and do this to get it, to direct it up the eustachian tube. Now, now you're going to need really 2 hands. But you could do the seal. You breathe in. Well, we'll always assume we're breathing in, but so I want to keep talking. So I'll just assume that we're breathing in here. But get the seal. You can actually do both, but go gentle. Now that's going to really direct it up there. Because you're actually doing the positioning and the swallow. But be careful. Don't overpressurize. Now, again, you're going to need now you're going to need one hand on the syringe, butt it up, get the seal. That's the maximum way of doing this, combining these two techniques. You can try the bone roll without the seal, without the Eustachian method, and it will send it'll open up the channel for the ozone to go up there. The swallow really is creating a secondary effect. I would experiment with both. As long as you're not over pressurizing, you're good to go. And you're going to need this if you're going to do the bone roll and the swallow. So try one, try the other independent, and then you can put it all together. If you have a lot of infection, a lot of inflammation, you don't need a lot to get it going. You might want to just treat the beginning section, get things dislodging. You might want to go a little bit layer by layer if you've had chronic issues, and it will go layer by layer because you've essentially had a clogged, stagnant region. Now all of a sudden you're hitting it with this activated oxygen, this incredible fired up oxygen. It's going to start moving things along. And eventually, if you have a lot of congestion, it will break through. It might take 10, 20, 30 treatments possibly. You can, within each treatment, if you're doing the swallow technique, you could do it several swallows. You could do one swallow and then, you know, take a pause, do another swallow. The amount of repetitions per treatment will vary on your condition, how you feel. You could start slow always, might swallow once, make sure you got it down. If everything's going good, you could do it again, or you could wait a couple hours. Once you have it down, you're going to have a feel for how many repetitions you might do. As long as you're not power pushing it, you're not going to force anything up there, and you're going to allow the system to heal. So if there's a lot of blockage, it's just going to go so far, but it's going to start to dislodge that blockage. So be patient, and just keep at it. You might do it every day for a couple of weeks. You're going to see change if you stay consistent and don't over aggravate yourself. All righty. If you have any questions, please contact me, Andrew at blueseawater.com. I'll post my phone number below. I'll post the link to that Eustachian video. And one other thing, these are the earplugs. I'll post a link to these below that you can use for the nose. They're silicone, they're great. You can wash them. You're going to need to put 2 or 3 together, really contour it up the nose deeply, and then, make sure it seals. Just blow out, seal the other nostril, blow out, and you'll know if you have a good seal. Okay, I hope this helps because I have been getting some feedback. If you have infection in the middle ear, or station tube, or you have blockages, as long as you do this in the cautionary manner that we described, I think you'll see some really incredible results. Take care. Thank you.